name is Daniel Tabak. I'm a medical oncologist here in Brazil, in Rio. And first of all, I'd like to thank Dr. White for his excellent presentation on a very, very difficult issue and matter. And here as a medical oncologist, I'm always very confused and pale with all the information that patients bring in regarding the issues about nutrition. Especially here in Brazil, that there's no real, I would say most of the places, preoccupation about the control studies, which I think is the main issue that you brought. And just recently, just yesterday, I went through an information in the paper. It was in the Wall Street Journal that over 200,000 observational studies were produced, and only less than very, very few control studies. So I think that making some of the statements regarding nutrition can be very dangerous regarding here, as we mentioned about cigarette smoking, that if we could find a safer way. I'm concerned that some of the issues brought about the food that we take in and the type of food could overcome some of the issues that you presented, like the most important things that have been documented, like obesity, like the use of alcohol, physical activity. And I think, and I read, and I think there was a very good paper that was put in by the American Cancer Society regarding their guidelines. And one of the issues that came up very good, especially something that we don't pay attention, is how much exercise is good. And the amount of exercise, people just say doing physical activity, but they put it in and quantify. It has to be active, intense over 75 minutes for a week, or slow for 300 minutes. So I think this is important. And the same thing, for example, about alcohol. Like they describe like 2 drinks a day, which accounts for 350 milliliters of beer, or just a little bit less, 5 ounces of wine would be the most amount that either men or women. And I'm concerned about that, for example, today, that we recommend alcohol intake for the control of cardiovascular disease. So I think there's some of the issues that should be put up. And as Latin American countries, I think that as a policy, we should be discussing some of the very simple issues that could be put in. For example, in schools, like teaching kids how to eat and how to do physical activity, and how we should be controlling their diet, especially when there's so many confusion about, even about fiber. There's so many confusing issues and studies saying that fiber is important or less important in terms of colon cancer. So I think with all this big confusion, I would like to see what's your opinion, especially regarding Latin America, because most of the issues have been put up for countries in the Northern Hemisphere. What would be the main issues that we should be talking about regarding nutrition and all these preventive factors that should be important in our countries? Thank you.
Yes, please.
If you go to the website, you will find that there's a link with PAHO, because this report, in fact, was taken up by PAHO and made it, and PAHO translated, and there are guidance for health professionals, there's guidance for the public, and also there's guidance for various levels of policymakers, from community organizations to health centers to the press. It's quite an elaborate process. I cannot summarize it here, but it is each of the stakeholders has a mandate, because the idea is not just to have, like the WHO puts a book together with all the numbers, but then that's it. In the case of this group, there's communication to consumers, to patients. There's a special section for people who are living with cancer. Either they're a patient or they have been treated. They also require a lot of information. So I would suggest that you go to the website, and PAHO has the material, the relevant material in Spanish. In fact, PAHO partnered with the WCRF process. And it's now, I think that the other point is that there's always a new study, you see. That's why the idea of having a continuous update allows for that information to be made available, so that you put it in the context of all the other information. And as you mentioned, there is very limited true cohort data. There's case controls, which have various limitations. Probably the closest to good data is what comes from long-term cohorts. It's so much information that comes up that you cannot be flipping up and down based on one study. That's why looking at this from a meta-analysis in a systematic manner is the only way that you can react. And I would urge you that, in fact, Brazil is sufficiently large, and this is actually works as an NGO. So Brazil might want to actually consider having a WCRF site here. There are WCRF sites in the UK, in Holland, in Hong Kong, in Japan, in Australia. So potentially, if there are people interested, you could host the WCRF site. The American Institute for Cancer Research is also one of the sites. And I think this is a process that needs to be continuous. That's why access to the website will provide you with updates on the topics as they emerge. And you have to look at the totality of the evidence. You cannot be flipping up and down based on one study.
I agree absolutely. I just wonder with the information that we have today, if there will be any recommendations. I mean, how you put today to our countries different from? Should they be different than from the northern countries?
Right. The point is that in fact, as you saw the names, there's at least a third of the people in the panel were from developing countries, less from Asia and elsewhere. But if there's enough interest, I'm sure that you could have a panel interpret and see if there's any things that should be done differently in terms of the local context. I know that Dr. Carlos Monteiro from University of Sao Paulo is actively engaged internationally, but he might be a focal point to set up a group here.
Okay, thank you. Yes, please.
Following the previous point, I think that there is not only a lack of information at a local level of our diet and our type of cancer. Because if you see the report that I think is very useful, it has specific guidelines for policy and for individuals, but taken from studies that have been done in other countries. That is your point. So my question, I would like to listen to your opinion. Why, as a Latin American continent, what would we need to promote more research on our diet, on our type of cancer? That is one question. And the other, why developed countries with a lot of resources have not done interventions, dietary interventions, because so far the evidence we have is based in observational studies, but what we really need is interventions.
There are two aspects to your question. One is the problem of cancer in Latin America is being approached mainly in terms of therapy. There are very few groups doing modern epidemiology on cancer. So it's partly their fault. I know that Brazil is getting ready for a cohort. I'm not sure, but I was here a year or 2 years ago, and there were discussions of having a large cohort established in Brazil. Because the other point is that it's not that people don't want to consider, but they don't read papers that are not in the international literature, that are not in peer-reviewed journal, that do not follow a systematic approach to evidence base. So, having said this, I think it's on our side to try to produce data so that we can have our own data with the basic. But it's a long-term project. Cancer is not like changing LDL cholesterol. And the biomarkers are really no good biomarkers for cancer because they go in different directions. It's actually very difficult. And it's also, you will see that the recommendations are based on foods containing. So it's not lycopene in a pill. And the data, in some cases, when you take a pill, is different when you eat it with the food. So even characterizing the exposure is very difficult. So, but my suggestion, if we want to do this seriously, you need USP or one of the major universities, in fact, to invest in developing cancer epidemiology in a meaningful way. For now, all of the material is available. The policy included more people from developing countries. It circulated extensively. So in that sense, representation of Latin America was relatively strong. For the whole of Africa, there was one person. And for the whole of China, there was one person. And for the whole of India, there was one person. There were 3 from Latin America. But it's not only the numbers, it's actually producing the data. All of the questions are valid, but Latin America is not contributing data to be able to incorporate into this sort of analysis.
Thank you. Yes, sir.
Yeah, I would like to make one comment in the importance of this meeting. My experience with presenting medical or healthcare data to government is that usually the information we have about what we should do with the money for health is not really going nicely to the politicians who represent us. So I think if we could prepare, let's say, as a summary of this meeting, like a small list of very clear items, because we have the items like hypertension, tobacco, diabetes, inactivity. So I would put also external causes. In my region, the third cause of death is accidents and violent death. So it's cardiovascular cancer and these external causes of death. I think if we could present a very simple document of this meeting that we could hand over to our politicians, I think would be something perhaps useful, because normally they decide on the budget with no relation to what we would recommend as the priorities for our country. So I don't know what you think about it. I think it would be a challenge to have a simple document, 2 pages, of what we think should be done to really have an impact. I just want to ask to Dr. our colleague from Colombia, why colorectal cancer increased so dramatically between 1999 and 2011 from 5.3 to 10.6 mortality? Is there an explanation? Yeah,
I believe that it's a question of better registry. Yes.
Because it's double, yes?
Yeah,